Dr. Shannon Barkley from the World Health Organization told us about the importance of the Declaration of Astana for primary care.
So I think Alma-Ata remains sort of the spiritual and philosophical center for primary healthcare, and certainly with this new declaration we weren't trying to replace it, we were just trying to update it for the 21st century and some of the new challenges that we're facing, and also to take account for where we didn't succeed in the ways that we would have liked to have succeeded. And so looking a bit more pragmatically, shall we say, at some of the challenges that primary healthcare and primary care are facing globally, challenges around things that didn't exist at the time of Alma-Ata, such as new digital technologies, concepts around multidisciplinary teams and how to use those more effectively, ways to ensure that some of the new data that we have around policies to affect and change health are being implemented globally, and also the changing disease burden in aging populations, which weren't yet such an extensive issue as they were at the time of the original declaration. So the new declaration keeps the spirit of Alma-Ata alive. I think for clinicians there are a few key messages. One, in primary care, that we should be aiming for a level of comprehensiveness that encompasses what patients need today. I think the Alma-Ata Declaration was a little bit more explicit around what was in and what was out in primary care. In today's world, the challenges that we've heard about today around morbidity and aging populations really say that we need to tailor the scope of practice of primary care to the needs of the populations that we're facing. And that's going to vary geographically, it's going to vary in urban and rural settings, it's going to vary for populations that are focused on perhaps groups that are facing more social depravity. It needs to be adapted to the local context. So that's one thing that's built in, and that we need the flexibility in our training to be able to produce different types of models of care based on where we're practicing and the population that we're serving. I think the other piece that it says quite explicitly is that as practitioners, our responsibility doesn't stop at our facility door, that we have a responsibility to be educating our patients and interfacing with our patients in a way that empowers them to be able to take responsibility and ownership of their own health in partnership with us, but also that we have a really critical role in advocacy and in our role in health policy and making sure that we're speaking to power, speaking to government in a way that enables them to make good decisions about policies for health systems and policies that affect the social and environmental and physical determinants.